my 4 witnesses, speech number 3, informative. 1, 2, 3, 4. Shot or not? Choice is a key word, and one that is often not presented to parents. Many parents struggle with finding the answers to their questions about vaccines, wanting to get the whole picture. Vaccines have played an important role in keeping certain diseases under control, but it is evident from epidemiological and historical records that other factors such as hygiene, nutrition, and living conditions are also responsible for reducing disease incidence. It is by becoming aware of both the importance of vaccines and their limitations that we can make the most informed and effective decision, not only for our own children's health, but as for the whole society. It appears to be fully accepted by vaccine proponents that without vaccines, we would again have rampant epidemics of diphtheria, pertussis, measles, and so on. These opinions are not hard to find, and in the plethora of information from pediatricians' offices, from the county health clinics, and from any number of medical websites that you can find online. It is normal for a parent to be concerned about the harmful effects of vaccines. Vaccines are 90 to 99% effective at preventing diseases, and when the disease does occur, the severity tends to be reduced drastically. Vaccines are extremely safe as they undergo harsh scrutiny and testing before they ever reach the public market. The most common side effects are irritability, swelling, redness, and fever. Despite an initial scare of autism, there is no increased risk of a child developing autism after receiving the measles, mumps, and rubella vaccine. This is also known as the MMR for those of you who have never heard it placed that way. The only association is that autism generally declares itself around the same time that the MMR vaccine is given. That is normally between 12 and 18 months of age. In the U.S., many diseases are not as common as they were in the past due to better nutrition, antibiotics, and most importantly, vaccines. Babies who are too young to be vaccinated, immunocompromised children, and pregnant women could potentially suffer harmful outcomes if exposed to any of these diseases. On the flip side, though, vaccinations could potentially be a cause of health problems and diseases like Alzheimer's, Parkinson's, and different types of cancers. The general idea against vaccinations is simple. Each time a child fights a childhood disease, their immune system is having to work harder and is learning to fight harder when other diseases come along. It is not proven that vaccines have eradicated diseases. When a live virus is used in the vaccine, infected virus is shed for anywhere from 4 to 21 days or more. And during this time, inoculated persons can give the disease or the side effects of the inoculation to any vulnerable person. This could be anyone with an immunocompromised problem, anyone that includes like cancer patients, children who are already sick, babies who have no good immune system. So doctors have started to recommend that children who receive some of these inoculations stay away from people who are immunocompromised. If vaccines are responsible for the reduction of diseases, we must wonder, at what cost has this triumph been won? We must consider the prices. Our loss of natural immunity to certain diseases, the disruption of the disease which might have resulted in reduced disease virulence over time, and long-term consequences that are just becoming evident, such as increasing levels of chronic health problems that may be vaccine related. It is by becoming aware not only of both the importance of vaccines and their limitations that we can make the most informed and effective decisions, but we also must be vigilant in trying to find out how we can help others become more aware, so that when we become knowledgeable, we also can spread the knowledge. Let us not be afraid of standing up for what it is that we want to do with our physicians, whether it is to accept the vaccinations or if it's to decline the vaccinations. Some doctors have said that it is okay to go without vaccinations, and they've encouraged breastfeeding for an extended amount of time because that builds the immune system up, thus enabling the child, as I said prior, to help fight any disease that might come their way. But remember that this is not just for our family, but this is for society as the whole.
Yay!